Now, I know I was first introduced to German new medicine from my father, who was giving lectures on it. I remember being totally fascinated, and the whole audience of doctors being fascinated by this, because it's a little bit different than what conventional medicine talks about. And it is based in science, but it really is outside of this scope of what biochemistry usually looks at. But before we really dive into it, can you tell us how you got involved with German new medicine and what really clicked for you and the concepts that brought you into it?
Yeah, so I am a chiropractor, and my background is in all things holistic health. I came across chiropractic work in 2005, and ever since then have been all about nutrition and detox and taking care of the spine and just healthy lifestyle interventions to, what I thought was to prevent disease. And I worked in that model for many years and saw people get well, but then there were some times where people would be doing all of the right things and they would develop cancer, and they'd have a breast cancer diagnosis. And some leaders in some of the groups that I was a part of, there'd be these paragons of health, and you just think this person's the healthiest person ever, and then a heart attack or some type of diagnosis, and just kind of leave you with a little question of what's going on there. And so I just continued my work in that field. And I became more interested in consciousness and mindset and our perception of our world. And so that started getting my attention in my own personal relationships and my own inner work. But I knew that there was some type of bridge between the mental, emotional work and the health realm. And I didn't know exactly what it was until I was listening to a podcast on magnesium supplementation. And the woman who was teaching mentioned very briefly German new medicine, and then just carried on with her interview. And I was like, what's that? And it was, 2017. So I'd already been in the alternative health world for a very long time, and I hadn't heard anything about it. And then I read Dr. Hamer's story, and my whole world flipped upside down because it made perfect sense to me. And my background as a chiropractor, I learned all the ologies, and embryology was one of my favorite courses, and how the human body develops from two cells and differentiates and turns into, this whole human body. And the work that Dr. Hamer did in discovering the purpose and the meaning of the germ layers and how the different germ layers operate and the conflicts, everything about it made perfect sense to me. And then I started having experiences that confirmed the biological laws, because it is an experiential science. You can see it in action in your own body. And so from there, I studied the work and started using it with my clients and patients, the people I was working with. And I saw how profound and transformative, and how every human, I believe, needs to know this body of knowledge, because without it, you're missing a big piece.
Yeah, it really is fascinating. I feel like everyone that kind of is exposed to it, whether it is that chance, like you hear the words German new medicine, you say, what's that? And just do a quick Google search, or, and go beyond that, you start to go down a rabbit hole. But as we go down that rabbit hole, let's start with one of the creator in Dr. Ryke Hamer, and how he came about this. Could you go into that story?
Yes. So Dr. Hamer in 1978 had a tragedy in his family, and his 17-year-old son was shot. And he survived for 3 months, but ended up passing away. And this is a huge shock for Dr. Hamer. And a few months after the loss, he discovered that he had testicular cancer. And he knew, he was very, very bright, very intuitive. And he knew that there was a connection between the loss of his son and the cancer that he developed. And so he worked in oncology, had access to patients. And so he began to speak with them and he started to see connections between every patient who had some type of cancer and some type of shocking trauma in their life. But not just random shocking trauma. It seemed very specific. So every man who had testicular cancer had a loss conflict. Everyone who had a lung cancer had a death fright conflict. Every woman who had a glandular breast cancer had a profound worry experience. And so he started to see, this is not random. There's something going on here. And then he looked in the brain. like you mentioned at the beginning, the brain is this mediator between the outside and the inside. And so he's like, okay, if there are, these emotional shocks happening, a loss of a child. Okay, so that's something that happens. And then there's something happening in the testicles, apparently, so there's something happening in the testicles or something that happened, in that person's experience. There has to be something in the brain because it's the mediator between the outside and the inside. And he started analyzing CT brain scans and saw that there were circles in specific regions of the brain that always correlated. So the shock, the brain, and the organ, there was a correlation between those three levels. And from there, he developed and discovered what has always been the case. This has always been going on. This is how nature operates. These are biological conflict shocks that catch the organism off guard, and it's an adaptation program. That's one of the major things that makes this so different than alternative health. I saw as a chiropractor, alternative health practitioner, I saw, cancer as something going wrong in the body because of toxins, because of, bad diet, that something's gone awry. And now this cancer has taken over because the immune system is damaged. But what Dr. Hamer discovered turns that upside down. He found that what's actually happening these are tissue adaptations intended to help the organism to survive the shock. So if you lost a child, what would the body, what's the biological response to a profound loss of a child? Let's make you more able to produce offspring. So the testicular tumor, the cancer, isn't something going wrong. It's something meant to enhance fertility and his ability to replace what was lost. And that's the case for every dis-ease. Everything that we've called the disease, we call a cancer, there is a biological purpose and meaning for those tissue adaptations. And when you understand that, you treat it completely differently.